Hi, this is Dr. Stephanie Wautier, and I'm the host of Conversations with a Chiropractor. I believe healing often begins with connection, and that's really what this podcast is about. These are real conversations about health, healing, life, and the stories that shape us. Some guests come from the wellness world, some come from the community, and some simply bring a life experience worth sharing. My hope is that each conversation invites you to listen, learn, reflect, and maybe see your own life or healing in a new way. Sit back, grab a cup of coffee, and enjoy this conversation with a chiropractor. Today on Conversations with a Chiropractor, I am so excited to be joined by Australian chiropractor Dr. Jason Gilbert. Dr. Gilbert spent 2 decades in South America bringing the mission of chiropractic to the people there. And then he has come back to Australia. He's done amazing things with hyperbaric chambers, and he's going to talk about Mercury Toxicity. We're going to talk about all kinds of things. Doc, thanks for being on this podcast.
Stephanie, thank you very much for inviting me to be here.
So I do want to start by asking you, what prompted your desire to go to Peru to bring chiropractic to the people of the Andes Mountains?
Sure, good question. That was actually me post a master's degree in chiropractic, wanting a break. And I'd met a Brazilian girl and in Europe, actually. And I thought, this is a really good time before I set up in Australia to go and, surf and get to know the culture and her family and all the rest. And when I was traveling around, I couldn't believe that most places I went to, chiropractors weren't there. They didn't exist. And I got to Peru, and as a surfer, you look at the map of South America and you go, well, if I'm going to live somewhere and work, it'd be Rio or Lima because of the proximity to the sea and the good waves. And at that time, Brazil was difficult as far as the visa went, and I really loved Peru. So there was one chiropractor in Peru before I got there and set up in Lima, and away I went. So it was just this absolute excitement that most chiropractors can relate to in regards to introducing something new to a population that's never been exposed to it. And before I knew it, I was traveling, up to the Andes and the Amazon, a city called Iquitos in the Amazon, and another one called 1K, and a couple of others in the Andes. And I was taking up my plastic spine. Imagine this, a bigger plastic spine than that, and my table, and on the back of tuk-tuks and, local radio stations and television stations with broken Spanish. So I was living the dream, absolutely living the dream. And interestingly, at that time as a new graduate, I really didn't appreciate the power, the potency of an adjustment. And when I was doing these campaigns, I was charging just a couple of dollars, and we would get many, many people. So all I'd really have time was time to do an adjustment, maybe some mobilization and, some soft tissue work if I needed to do a little bit, but it wasn't a lot. That's how I learned the power of chiropractic. Admittedly, I'd be there for 3 or 4 days and people would come 3 or 4 days in a row. But that's when I learned, my goodness, firstly, as a young grad, you could think, I'm healing the person. That's me doing that. But then you realize the inherent recuperative ability or power of the body to heal itself. And when those blockages are removed. So, wow, so many facets of learning, in South America.
Wow. And you didn't have a common language, or did you speak the language? Were you able to communicate with them?
No, I didn't. I had very little actually, but as I explain to people, let's imagine a multinational company taking foreigners down to Brazil or Peru, that they often go down and work with many other foreigners. So they're speaking English a lot. And I guess the topics that they could work with in their job are diverse. Whereas a chiropractor, work by myself, it's one-on-one with a local who speaks Spanish or Portuguese. And we start with a base. It's like as soon as you learn, okay, face up, face down, on your side, breathe in, and you realize that a lot of the anatomical terminology is, the base is Latin. So that really helped as well. So I think that went in my favor, even though obviously at the start, I was very difficult to communicate, really was.
Yeah. I think it does sort of express the power of physical touch, and communicating with your body and your eyes and, your just a smile, or that was probably a really powerful connection when you didn't have a common language to connect
That's a
with.
really good point. Really good point. And over the years, I'd always spend a lot of money from a different currency, spending it in American dollars to fly back to the Parker seminars. And yeah, I'd love that because you just exposed to the amazing, predominantly American chiropractors, but from all over the States, sometimes all over the world. And you go, listen to them. And I remember one chiropractor was like, it's 90% personality. I'm like, what do you mean by that? And okay, whether it is or not, obviously the technique, the adjustment, your knowledge is all so important. But his point is that in regards to capturing someone's attention with something new and having that little short window of attention, which is far less now than what it was 15 or 20 years ago, 30 when I graduated, to educate the person in regards to how chiropractic works. Well, hey, you better be engaging. You better, rely on all those facets you just explained, and love what you do and have passion for what you do. And then, I really can see that firsthand in South America, and especially in those days, as you mentioned, where my Portuguese and Spanish was compromised with development.
So you became quite popular in your 20 years there, right? You were actually on a show, like a television show, correct?
Yes. That was, okay. So the story behind that was when I opened my clinic in Peru, I thought, great, I'm offering something amazing. It's going to be full before I know it. I'm there after 4 weeks sort of going, oh, what's going on here? I've only got 1 or 2 people a day coming in. What do I do? So I did a press release and I invited every child in Peru on mainstream television to come and have a spinal examination. And my clinic went basically 0 to 60 or 70 people a day, predominantly kids. But then after that, it normalized around 30 to 40. And from that time onwards, being on television regularly was a really important part of the way that I could get to people and educate them. Not only very rarely it was about chiropractic as such, because people don't really want to know about chiropractic. They want to know about what they're suffering from, what you offer in terms that they'll understand. And then you'll have the chance, typically on your report of findings or the second visit, to go deeper on chiropractic. But, I'd be on television over the years talking about, high heels with women, heavy handbags, sleeping positions, I guess the correct way to do housework, predominantly women's programs. So they're women's themes, not always, but often. And on the back of that, so I was on television, diversity programs almost weekly in Peru and Brazil. And I'm going to go back to Brazil next week and there'll be a couple of programs I'll go on Brazil. So it's been something for years now, but this also came at the same time of me as a young chiropractor going, hang on, there's a reason for that sciatica. There's a reason for that headache. And when you just take a little bit longer to investigate the cause of that and you realize, oh, hang on, the person's got right-sided pain and they're doing a right-sided activity at work or they're sleeping face down or whatever, I started to just note down the cause of every problem, every symptom that was coming in. And off that, I wrote a book. And that book was it's called The Secret of a Healthy Spine. It's actually in English, but I wrote it first in Portuguese and I wrote in Spanish, and English came 10 years later. And that book is what actually got me on to that opportunity to present that program at Fox, because they wanted to do this television program interviewing about doctors and health problems. And I just turned up to be a consultant, a spinal consultant. And I used my book as a portfolio, I guess, and got the job as a presenter.
Wow, that's amazing.
Yeah.
I mean, I think that we shouldn't take that lightly, because here you are in another country, not even having that language as your, like language you're born with. And I will say that, I don't know, don't you think sometimes it's like you were there at the right time, at the right place, with the right momentum, like with the right energy, and then things explode, right? This episode of Conversations with a Chiropractor is supported by Lemon Grove Oil. One of the things I'm always paying attention to, both in this podcast and in my work, is where something comes from. Not just what a product says it does, but who created it, why they created it, and whether there is real care behind it. That is one of the reasons lemon grove oil feels like such a natural fit here. Lemon Grove was founded by chiropractor Dr. Jerry Del Canton. This is not a random wellness brand that appeared overnight because CBD became popular. It grew out of the chiropractic world, where trust matters, where quality matters, and where people are often looking for thoughtful ways to support themselves between visits, during their busy seasons of life, and in the day-to-day routines that shape how they feel. Lemon Grove offers professional-grade CBD products, including topical lotions, butters, roll-ons, and gummies. They focus on quality, transparency, THC-free formulations with third-party testing, and products designed with healthcare providers in mind. I think that matters because when you are choosing something for yourself or your family, you want more than nice packaging. You want to know there is a real philosophy behind it. If you're curious about Lemon Grove oil, visit their website at www.lemongroveoil.com.
Visit the link in the description and use code DRStephanie at checkout to save 10% on your next order. This offer is exclusive to listeners of Conversations with a Chiropractor.
Yeah, really good point. I think I'm like many other people that we don't stop to, I won't say pat ourselves on the back, but, like look at what we've done and what we've achieved. And one of the things I know that I've done is touched thousands of lives in South America, both in Peru and Brazil, whether it be directly, whether it be the university program that I helped set up in Brazil. That was the first chiropractic graduate program in Latin America that we helped set up. So I worked with a lot of those students and who turn into chiropractors. So indirectly, they're going to affect people's lives. So I indirectly help those people's lives as well. Plus the opportunity to educate on television, on radio and those ways. So it's a beautiful thing to be able to be passionate about something, and not necessarily chiropractic. It could be health or anything, but also have the means of educating people in regards to how it can change their lives. So
that's so astounding that you were one of the founders of that school in Brazil. How did that go? Like, were there different teachers? Were you one of the main teachers? Were you one of the founders? Can you tell us a little bit about that?
Yeah, the guy responsible, his name's Eduardo Brasha, and he studied, he was a doctor and he studied in the States, postgraduate actually in chiropractic. And I went to help him out while he was on his honeymoon, actually. So I did a locum there in Sao Paulo. And then I stayed a little longer working, but he actually at the time worked on the owner of this university. And the owner said, I want a chiropractic program by this time. I think it was like August, and he wanted it for the next year. And so Eduardo had to go, and he went to Palmer and a few other universities in the States, and ended up going with Western States as the university to help guide this new course through. And I came in helping with philosophy and the adjusting component, and then eventually clinic. So I'm a small part in that, but it was more the reach in regards to giving these chiropractors jobs, or letting them come and observe me, or going and doing little social campaigns of chiropractors in their towns and cities. So as you said, things in life are often a timing thing. So if we went to Brazil today, we've gone from having, very few chiropractors back then, maybe 10 in the whole country, and now we have 2,000 chiropractors.
Wow.
And they're interestingly, so I was going to say, interesting, their strategy was to get chiropractic recognized and legalized, instead of going to Congress and having Congress sit down and spend time voting on the rights, of 20 chiropractors who are educated outside of the country. They said, well, no, let's go to the Ministry of Education and let's start chiropractic programs to build the numbers up to be enough of to warrant Congress sitting down and passing laws. And that's where they're at right now. They're going through, this is 20 years later, but there's 90,000 physios in the country and there's a misunderstanding about what chiropractic does. That's really important, so that strategy is a really important one for other countries where chiropractic's new to follow. Then you get it to education level properly and then take it to law after that.
I'm so intrigued by this because I was just talking to a friend who's been practicing in Ghana, and there are no chiropractic schools in Ghana or Nigeria. The interesting thing that we were talking about is that he is revered almost as like a king status. Like chiropractors are the same sort of status as a medical doctor. In fact, it's pretty amazing to me. I was born and raised in the United States. We chiropractors have had our fair share of, oh, you're a snake oil salesman. Oh, you're a less than.
Yeah.
Oh, what do you do? So interesting that you were a pioneer in getting chiropractic respected in Brazil. Tell me a little bit about what the culture in Australia is in terms of culturally. Are chiropractors respected? Do you think that the population there understands the difference between a physiotherapist and a chiropractor in Australia?
Yeah, really good point. Okay, because that was interesting because most of my adult life and professional life, I had the beautiful situation of being able to, I guess, look at errors in Australia, the States, New Zealand, and other countries around education, educating the public in regards to what chiropractors do and contribute to the direction that would take in countries where it was new. It's beautiful. Then I've come home and I came home because mum was sick, and in that time I'd studied functional medicine and she had actually late stage lung cancer. She's still alive, thankfully, but that's why I came home. There's always a purpose, isn't there? And I stayed because I want to be close to my mum, my family and all the rest. But I sadly see that the population in general, they'll either have had a really great experience with chiropractic and be great fans of chiropractic, right? And some of that percentage of people won't know how it works. They'll just know it works. And then there's other ones that, I guess, because chiropractic is a profession, or the chiropractor who saw them on their first or second visit didn't educate them in regards to, hey, the pain is actually good. We're using the pain to find the underlying problem and let's correct that. Then your body will naturally reduce the pain. So that puts a chiropractor in a position where it's quite challenging because they're either going to, the potency and the effect of the adjustment will either be great and the person's going to think, oh, you're amazing, because they're obviously going to think that the person cured them with that degree of education, yeah? Or they'll go, two other things can happen. Nothing will happen that they can feel, but it obviously did happen. Nervous system, it just takes a little while. Or sometimes, rarely, you'll get an exacerbation of a symptom. Those last two possibilities, chiropractic didn't work, So, and then obviously we're relying on the Chiropractic Association to educate people, the public, in regards to what chiropractic does. Most people really don't understand that in Australia, it's a 5-year course. Chiropractic is graduating with a master's degree level, that they study radiology and neurology, and they can take x-rays. So they get a license to take x-rays. So not comparing, saying one's better than the other, but physiotherapy doesn't have that. But I guess because of the tradition behind physiotherapy and quite possibly the fact that physiotherapists and the associations back in the day did a better job of educating people of, to know when they go to physio. Wow, we're in this moment that people really don't know. And it's a bit disappointing to come back after 2 decades expecting that to improve while I was away and actually see that some chiropractic programs, numbers of new grads are, dwindling, osteopathy. Some chiropractors are coming out, Steph, and they're saying, come to me because I don't do the dangerous adjustment. And you're like, it's just, we need more, I guess, solidarity.
Yes.
But more than anything, we need to understand from a very early stage what chiropractic does, what it offers, and how to deliver that message. Because a lot of chiropractors, not only chiropractors, but other professionals, don't know how to communicate to the public in regards to what they do. What's the definition? How's it work? And this is something really important for everybody to understand, that whole 12-second elevator pitch thing. Well, hopefully we got more than 12 seconds, but we often don't. So we want to make sure we know how to educate. And I feel, unfortunately, that could be something in any course, physio, chiro, osteo, all those courses. to have those graduate professionals eventually have that capability. It's so important.
So, Doc, give me that 12-second elevator pitch. Give our listeners that 12-second elevator pitch.
Yeah, good on you. I love this. I love you challenging me, Steph. Okay, firstly, your body's intelligent. Your brain controls every single thing that happens in your body, okay, via the nervous system. That nervous system, unfortunately or fortunately, is encased within a mobile, movable vertebral column, while your brain is well protected by a immobile skull. The spinal column, being mobile, can't protect the spinal cord or the nerve roots as efficiently. So unfortunately, our posture, our falls, our life, our accidents, all of this can end up affecting our nervous system and the ability of the brain to communicate with the body due to the fact that it can cause dysfunctions, which we call subluxations in the spine. And chiropractors, thankfully, remove those blockages very efficiently, allow the brain to communicate with the body and heal itself. That was more than 12 seconds, but that's my condensed version.
I love it. I love it. I love our listeners to hear that from you, who's been around the world talking about chiropractic.
Yeah, and
Doc,
just to expand on that as well. This is really interesting that is not theory. It's not philosophy. That's fact.
yes.
We've all fallen in our head and we didn't wake up brain damage.
Yeah.
But hey, we've fallen on our bottoms and then years or decades later found out that we had disc degeneration because we woke up with sciatic pain, for example. So we've got to recognize that the brain is obviously very intelligent. Any symptom that it causes is a reflex calling our attention to an underlying problem. Yeah. And when this isn't, once again, conjecture, it is fact. So if we're understanding that when we choose to focus on our health, that we can actually choose a disease professional who's great at focusing at symptoms and making you feel better, okay, and diagnosing, or we can focus on a health professional focused on the true underlying cause of your symptoms or disease, then we can make good choices.
Yeah, absolutely. Healing ourselves naturally from the inside out. Yeah.
Exactly.
So I'm going to talk a little bit about your journey. When you were, I think it's when you were in Brazil, you had your mercury fillings removed, your amalgams, and then you got mercury toxicity.
Yes.
Wow. So was it a dentist who was not following the proper, like whatever you would call it, biofunctional process to protect you when those fillings were removed?
Yes, it was. It was my dentist. It was here in Australia, actually, on a trip back.
It was.
And, I have to take responsibility because I was trying to get these things removed fast while I was here. And the dentist had zero knowledge that there was a full procedure that you need and protocols you need to follow. And then I had severe toxicity after. I didn't relate it to the removal of the fillings. But to give you an idea, 0 to 6 is a tolerable level for mercury in the body. I was 600.
Wow.
And the person, like the next worst case under me that the doctor I was dealing with had seen or heard of was a man who painted the Harbour Bridge at Sydney for 25 years and he was 250. So I was 600.
Wow.
And I was presenting a live program in Brazil, forgetting what I was saying halfway through a phrase. So I had clear signs that neurological, problems were occurring. I had chronic gastrointestinal problems, had candida off the charts, had all this stuff going on. So luckily I found out about the mercury toxicity and that wasn't easy to find out. And at the time I was treating one of my patients was the founder of functional medicine in Brazil. He was and probably still is Brazil's most published cardiologist. He studied at Harvard, got a job with Eli Lilly not long after graduating, and then basically turned on and just didn't want to continue in a system that was treating the effects of poor lifestyle choices in general. Okay, this is obviously, but so he's come back on he studied functional medicine in the States and brought that back to Brazil. So he invited me he not only helped me, but he invited me to study functional medicine with him and a group of specialists that he was teaching it to in Brazil.
Wow.
So thing in life, remember, we can turn a crisis into an opportunity. And with our health, especially if we're suffering, our body predominantly is giving us the opportunity to find the underlying cause and hopefully, if it's not too advanced, come back and be stronger than ever after it because of what we learned through that experience. And that was most
Yeah.
definitely the case.
Wow. You had another very unfortunate thing happen to your body where you ended up needing spinal surgery. Can you
Yes.
tell us about that?
That was interesting because those years in Brazil and Peru, but more in Brazil, I'd have quite a few clients that would go back to their neurosurgeons or orthopedic surgeons and tell them, hey, I don't need surgery now, or my symptoms have gone. And it was this foreigner, this Australian who helped. And so I received quite a few patients over the years from neurosurgeons and orthopedic surgeons. Yeah. They knew that what I was doing was helping some patients, and they also knew that many of their patients had done everything, lots of physio, lots of other things and medications, all the rest. They knew that they were trying to avoid surgery. Yeah. But many
Yes.
times nothing left. So they had to operate, even though on an MRI, they'd see that there wasn't, that much degeneration to warrant that. So over the years, I guess developed this reputation. Many, many times I dealt with people who had been operated and let's say an L5S1 disc problem, but it was a sacroiliac problem was the cause. And you're like, it's the cause. Is this the pain you had before surgery? You're like, yes. So you can imagine my inner voice. You go, God, another one that was avoidable. However, I was humbled because mine most definitely was surgical. Thank God the medical system was there to help me in my, I had extrusion of the disc material a centimeter up into the spinal canal and a centimeter down. So there was no way that anything was going to dislodge that. And I was in excruciating pain. And I think that was brought on by the fact that I worked over a small table, always on the same side of the table. And we do what we call the supine adjustment, where when I had, those days that I was seeing lots of people in Peru, well, I'd actually lift them up. So I'd side bend to the left and then I'd lift them up again. And with time, I'm just worn out. I did exactly what I was telling people not to do. Is it ego? Is it thinking, no, it can't happen to me? It's been everything. So there's a whole learning to be gained from that experience. And thankfully, I got into chiropractic because I had pain from a very young age, 7 at age more or less. So I thought it was normal. So thankfully, getting operated around 40, I'm 56 now, that's made me stronger, more flexible, better now than ever. Because it finally helped correct a problem that started way back in childhood, a biomechanical, I had a retrolaesthesis that affected the biomechanics and sped up the degeneration of the disc. So as you mentioned, a really important lesson. But what I meant to say in both of those cases, I was exposed to hyperbaric oxygen therapy. And both of those cases opened my mind as a patient first, due to the fact that, my goodness, it was a really important part of the healing journey. To go full circle where I'm now the medical director of a company here in Australia, and I produce courses on hyperbaric oxygen therapy and teach other practitioners about how important it is. So once again, something really unpleasant has led to something really amazing. And that's an important part of my life now with chiropractic. I'm a sports chiropractor. I work with the World Surfing League, and next week I'll be doing an event, for example. So that modality, functional medicine and hyperbaric oxygen therapy, incredible. Absolutely incredible. I think as professionals, if we're going, and we do unfortunately suffer along the way, once again, it's our chance to incorporate what helps us in the healing journey.
Yes, absolutely. Absolutely. Would you tell our listeners what hyperbaric oxygen does for them or does for the body?
Yeah. So let's imagine that when we breathe, our body relies on breathing in oxygen, to get it to the mitochondria of the cells. That's the little engine of the cell that produces energy, in order to function. Now, there's only 21% oxygen in air. And when we breathe that in, that binds with red blood cells to hemoglobin. And most of us have those red blood cells between 98 and 99% saturated. Let's imagine we have a challenge in our body that actually needs more oxygen than what we can deliver. For example, injuries, inflammation, brain injuries, trauma, concussion, dementia, stroke, and so many more. What we call these things, these would be, let's say, micro injuries inside our body, all major ones. Different to other things that we could do in our health. where let's say I need to get fit. Well, I've got a choice. I just go to the gym and I train more. I move more. I might have had a sedentary lifestyle. I can change that. Let's say that part of what I need is to improve my diet. Great. I have control of that, or take a supplement, or be less stressed out, improve sleep, etc. I can't go unless I do some breath work and get a little bit more oxygen into the cells. I can't saturate those cells with more than 100% because they're already basically saturated. But with hyperbaric oxygen therapy, you're in a chamber under pressure, and that pressure helps get a huge amount of oxygen into the plasma. Now, the plasma is the liquid portion of the blood that takes those red blood cells all around the body. And in this way, we are able to get more oxygen to the mitochondria. It actually increases the efficiency and also the number of mitochondria in the cells. So each cell with more energy produced by the mitochondria helps that organ do its job better. So let's say that liver needs to detox better. It can do that better. Let's say the brain's had an injury. Well, incredibly, after about 10 sessions at 1.5 atmospheres in the chamber, you get neurogenesis, the creation of new neurons, or the creation of new blood vessels called angiogenesis. What else do we get? We get the stimulation of stem cells because they're created predominantly in the bone marrow. And the pressure helps after about 5 to 8 sessions get a significant number of stem cells out. So, incredible. I've gone into this journey with myself and then observed with my clients because I have a chamber at home and diversity of problems that are recovering positively due to the fact that we can get oxygen in that chamber, okay, to areas of the body that have been relatively hypoxic, meaning that there's less oxygen there. And that's incredible. If we're looking at, let's take it back to the basic step. Let's look at the fact that we can go weeks without food, sometimes months. Yeah. It's important, but we can go a long time without it. Water, around 6 days. We can go without drinking water before we pass. Oxygen's about 3 to 6 minutes. It's so important. And think about water supply, because we're chiropractors. The brain needs to communicate with every cell and organ of the body. Hey, if we don't have nerve supply, our heart will stop functioning immediately.
Yes.
When we're putting these things into perspective, what it helps is people understand that, hey, you make sure that oxygen is getting to where it needs to get to. Compensate events in the past or lifestyle choices that might have compromised that. You look up nervous system, and correct those blockages that are there, whether you know it or not. You look after your diet, okay? Give yourself the best diet possible, whole foods, no rocket science there. Try and stay away from the toxins. Get good sleep, look after your stress and hydrate well. The pillars of health are there.
Yeah. I love how you break it down so simply. And actually, I was looking at your Facebook page and you were like, there's all these health fads, right? There's all this information, people really trying to sell us the next best thing. But you're bringing it down to these pillars of health that are very simple. And, you even kind of mention like relationships and, sleep and things that people maybe don't correlate so directly to their health.
Understandable, yeah, because many of these things, let's say work, for example, we're highly functioning, we think we're dealing with stress well, but it doesn't mean that our body's not under stress in order to adapt to the situation we're putting it in. Yeah. Same thing in relationship of any kind. It could be a work relationship, a romantic relationship. If we have, we're adapting to thoughts or situations that we're putting our mind under that actually have it increasing the level of cortisol and putting us into a stressful state, our body sees that elevation of cortisol to be no different to other factors that would increase cortisol. And back in the day, that would have been a dinosaur or an invading tribe, and that would have risen to help us survive, meaning we could fight or fly or run away from that. So we can do that via an emotional, a chemical, or a physical factor. And when it comes down to relationships, that's the emotional side. The sleep's the emotional side. But we've really got to nurture that, because what I'm seeing in, 2026, hey, wow, there's so many ways to be distracted. There's so many ways we can have relationships online. When I'm saying that, friendships, working with co-workers, we're showing up for lots of people. There's a lot going on.
There There is. I want to pick your brain about so many things. I want to ask you about surfing. So you are a chiropractor for this surfing organization, and I'm not going to say it right, the World Surfing League.
Oh.
And I mean, I think that's astounding. I mean, I imagine those surfers and their spectacular core strength, but also the violence of the waves as they can be taken out. Like, tell me a little bit about your physical body in surfing, and then how you treat these surfers.
Sure. Yeah, good question. With myself, I love surfing. So it's been a dream to be able to combine my love of health and my love of surfing and help professional surfers on that level. And that started years ago with biomechanical help to now many of the surfers on tour are getting in contact because they have like a health problem or some sort of challenge that they can't get on top of. But with myself, I would attribute some of my back problems to surfing way back in the day, like falling on a sandbank, hitting my head, or falling on my bottom, for example, on a sandbank and not correcting it. The whole idea is it's a bit like we've got a great culture around eating something and then brushing our teeth after it. But we don't have a really good idea or habit around having a fall, having a trauma, or even a predominant sporting position and compensating for it after. Yeah. Now, to be able to take my experience and my benefit, one of the reasons I'm a chiropractor is because an ex-world surfing champion told me to go to a chiropractor.
Really?
So I've taken my experience, and now to be able to work with that and help the new generation of surfers is incredible.
So I saw when we first started that you have a microscope on your desk. Tell me a little bit about what you're doing with that in your office.
I love your questions, by the way, Steph. So that's really observant of you. So remember before I mentioned that our journey, when we heal, especially for practitioners or professionals involved with health, it's an opportunity to learn from that and incorporate it in what we do. And part of my journey around Mercury was doing and being exposed to live blood microscopy in Brazil. Oh. And I was blown away. Like I had candida, fermentation, parasitosis, dysbiosis in my blood, and you could see it under the screen everywhere going crazy. And this was actually with a neurologist. He'd been a neurologist for 40 years and then turned towards functional medicine using a live blood microscope that he learned in Germany. Anyway, we went on a protocol that involved hyperbaric oxygen therapy because parasites and mold hate oxygen. So you introduce oxygen at a high level in there, guess what? They can't thrive. Yeah. I changed my diet. We talked about diet. I took sodium bicarbonate, baking soda, which is alkaline. Okay, because my blood was way too acidic. And then in 2 weeks, are you kidding me? It was beautiful and clear. So back then, that's what led me to the live blood microscopy. And since then, what's always been on my mind and my focus is that if someone clearly through their history has an acidic lifestyle, they smoke, they drink lots of sugar, sometimes medications as well, you'll often see that because that acidic terrain promotes these organisms to thrive. Yeah. And you often see that the introduction of something alkaline changes that really fast. And I see it under the microscope. Like if I had heard this somewhere else, I'd go, oh yeah, sure. And one of the things that I've been exposed to recently is the Kangen water. Now, I went to a retreat. It was a women's retreat. That was the first time I took my microscope and the computer screen to the retreat. And the first woman's blood was incredible. It was like enviable. I see one sample like that every couple of weeks where the red blood cells are beautifully separated. The plasma is pretty clean, but most importantly, there's movement there. Because most people, even though they're hydrated, come out and they see that their blood's aggregated. Yeah. And obviously if red blood cells are stuck together, we can't exchange oxygen for CO2 easily. Yeah. Anyway, second woman comes, her blood was the same. Third woman the same. The fourth woman the same. Like I said to the facilitator, what's going on here? They've all got amazing samples. I never see this. And I said, what have you done? Have you meditated yet? Have you done breath work? She said, no, they just arrived here. And she said, the only thing they've all done is had that water over there, that ionized water. And I was like, what is that? So I got in contact with the guy who left it there and I told him, I said, I'm not sure whether you know this, but this is what I saw under a microscope. Then that weekend, he actually said, can we test our blood? I'd love to see that. And we did. And I was like, I'm incredible. Like when I saw the effect on my blood, I had to have one. It's the Kangen unit. And now what I do is that when people come, I do my blood, and most of us are unaware of the pillars of health. Yeah. But
Yes.
they drink 2 glasses of water. In about half an hour later, I tested again. It's absolutely incredible. Every single person has red blood cells that are separated, therefore able to exchange oxygen and energized. And what the Kangen unit has is titanium plates that produce hydrogen gas. Yeah. And you can choose if it's alkaline or what pH you want as well. So absolutely incredible. And that's something for anyone listening that I can vouch for. I've seen amazing things under the microscope. I've actually worked with other practitioners now that have in their clinics, because if we're supporting people, we need to support them on every level. And as I've just mentioned before, it's not rocket science. Give the body the basics. Try and emulate what we would have been exposed to 10,000, 20,000 years ago. Good quality water, good quality food, 0 toxins or a minimum of toxins these days if we can. Good sleep. We weren't there thinking about a million things. We're very present, and good movement. Don't forget the movement as well. That's my experience there. And, like what I'd say to everyone also, Steph, is if anyone wants any information after this, please contact me, because I'll pass all of this information on.
Wonderful. So, Doc, we can find you at jasongilbert.com, and we have to put .au, correct?
Yes, for Australia. Yes.
So it's funny, when I was looking for you online, there are a lot of Jason Gilberts in this world.
That's why mine Instagram's Jason Gilbert Official, because there's one actually on death row, and I thought he's not doing me any favors. Years ago. Poor fella.
No, we have to find the right Jason Gilbert.
Yeah,
well,
exactly.
You have just been such a breath of fresh air. I'm so proud to call you my chiropractic colleague. You've done so much for the world. You've done so much for education and bringing chiropractic to places where they would never have been exposed before. So I hope that you feel like you have been used mightily in this world. And you're still young. You still are navigating and taking care of people in Australia and bringing chiropractic and hyperbaric and this amazing Kangen water. And you're very inspiring, Doc. It's been such an honor to have you on my podcast.
Thank you very much for those kind words, Steph. It's really beautiful. And congratulations as well. We need to be out there like you're doing now and getting information to people, especially in a world where there's so many ways that we can get the wrong information.
Yeah.
It's very confusing. We go online, we go on Instagram or Facebook, and there's some amazing information, but sometimes it can be confusing. So I love the idea of podcasts, and congratulations. Your questions have been amazing, engaging, and once again, good work. Congratulations on your work. And thank you for the invite.
Thank you so much for your time.
No worries at all. All the best.
Thanks.
Thank you so much for listening. If you've enjoyed this podcast, would you please rate it, review it, like, or subscribe? You can find me on social media at wautierwellness.com, Dr. Stephanie Wautier on Instagram, or Wautier Wellness Chiropractic and Massage on Facebook. And I'm so curious where your next conversation will take you. This episode of Conversations with a Chiropractor is supported by Lemon Grove Oil. One of the things I'm always paying attention to, both in this podcast and in my work, is where something comes from. Not just what a product says it does, but who created it, why they created it, and whether there is real care behind it. That is one of the reasons Lemon Grove Oil feels like such a natural fit here. Lemon Grove was founded by chiropractor Dr. Jerry Del Canton. This is not a random wellness brand that appeared overnight because CBD became popular. It grew out of the chiropractic world, where trust matters, where quality matters, and where people are often looking for thoughtful ways to support themselves between visits, during their busy seasons of life, and in the day-to-day routines that shape how they feel. Lemon Grove offers professional-grade CBD products, including topical lotions, butters, roll-ons, and gummies. They focus on quality, transparency, THC-free formulations with third-party testing, and products designed with healthcare providers in mind. I think that matters because when you are choosing something for yourself or your family, you want more than nice packaging. you want to know there is a real philosophy behind it. If you're curious about lemon grove oil, visit their website at www.lemongroveoil.com.
Visit the link in the description and use code DRStephanie at checkout to save 10% on your next order. This offer is exclusive to listeners of Conversations with a Chiropractor.